I wish to acknowledge the Darkinjung people as the traditional custodians of the land on which I work. I pay my respects to the elders past and present and recognise the continuing connection and contribution to the land. Welcome back to Matter of Vax. I'm Steph O'Connell. Hepatitis is an inflammation of the liver which can lead to a range of health problems, some of which can be fatal. World Health Organization estimates today around 58 million people live with the chronic disease. 1.5 million new cases of hepatitis C per year mean this is a disease we should all know more about. My guest today is Nafisa Yussf. Nafisa is a public health professional whose background includes community engagement and social research in both government and non-government sectors. She's the co-founder, director and chair of Hepatitis B Voices Australia, a non-profit community-led organisation that's wholly led by people affected by hepatitis B in Australia. Welcome, Nafisa.
Thanks, Steph. Thanks for having me.
I'm really happy you could join us. Let's get serious about hepatitis. First of all, tell us more. What is hepatitis?
As you mentioned, Steph, it's an inflammation of the liver. So essentially a virus that attacks the liver. And it can be caused by several different factors, including viruses, toxins, alcohol, autoimmune diseases. The most common types of viral hepatitis are hepatitis A, B, C, D, and E. Yep, we're going through the alphabet. And each is caused by a different virus. So hepatitis A is typically contracted through contaminated water or food. This is not very common in Australia. Hepatitis B is transmitted through infected blood or other bodily fluids. Hep C is also spread through infected blood, often sharing needles such as injecting drugs, for example. Hepatitis D only occurs in people who are already infected with hepatitis B, and hepatitis E is usually spread through contaminated water. Again, not very common. Just wanted to clarify on language. So we might sometimes say chronic hepatitis B, which is if someone has had hepatitis for more than 12 months, then it becomes lifelong. It is important to know that, I guess, most people who have hepatitis don't feel any symptoms. One of the misconceptions we hear a lot in our communities is that, oh, but I feel 100% fine. But yeah, most people don't experience symptoms. And, some people might experience fatigue or nausea, yellowing of the skin or eyes, which again is not very often. But the best way to know is, I guess, people getting tested and to know for sure. And as you mentioned earlier, hepatitis can lead to liver cancer if it's not treated.
With so much hepatitis, how are we contracting this? Who's most affected?
In Australia alone, there are about 230,000 people living with chronic hepatitis B and about 115,000 living with hepatitis C. So it's very common. That's a lot of people. In reality, is that anyone can be affected by hepatitis. And the only way to know is someone to see their doctor, get a blood test, and to confirm. However, there are some populations that are more disproportionately affected by viral hepatitis. So for hepatitis B, it's predominantly Indigenous communities, people who are born in countries where there is no or low vaccinations, men who have sex with men, people who inject drugs, particularly for hepatitis C. For hepatitis B, the most common way of transmission globally is mother-to-child transmission. So testing and vaccinations are critical during pregnancy.
Nafisa, tell us more about prevention. It seems like with 58 million people living with chronic disease in the world, there must be a lot out there in regards to prevention.
Yeah, you're absolutely right. We're very fortunate that we have safe and effective vaccinations for hepatitis A and hepatitis B. Hepatitis A and E are not very common in Australia, as said earlier, and practicing good hygiene, for example, washing hands, can prevent infection. Safe sex practices, avoiding sharing needles and other unsterile equipment. And of course, the most important way, as I said, is to get tested, get vaccinated for those viruses that have a vaccination. So there's a lot that we can do to prevent hepatitis. I think the challenges sometimes are the awareness and the knowledge to be able to prevent it.
So, what vaccinations are available and when should we be getting them?
So vaccinations are available for hepatitis A and B. So hepatitis B vaccinations is typically included in childhood vaccinations in Australia. So usually at birth, then 2, 4, and 6 months. And there's an additional dose given to babies who are born mothers with hepatitis B. Catch up vaccinations is also highly recommended for people who have not previously received vaccination, for example, if they've missed it as a child. Hepatitis A vaccinations is recommended for people who are traveling to countries where hepatitis A is prevalent or other people who might be at risk. But again, it's really important for people to talk to their doctor, their GP about what vaccinations they need because everyone's circumstance is different.
So, how are we as Australians going with prevention of hepatitis?
Generally speaking, Australia is doing well in hepatitis prevention. However, as we talked about earlier, some types of hepatitis can be chronic. So, for example, hepatitis B and C. And so prevention might be great at some point, but if someone already has a chronic condition, prevention is not really so important. Then it's more about managing and making sure that the people are looking after themselves. So for hepatitis B, there is no cure. Once you have it for life. And obviously, this can have a huge impact on people's lives. Research has shown that there's a lot of stigma around hepatitis B and C. There's lack of awareness, lack of knowledge, and understanding of hepatitis, again, which can really impact people's health and well being, like mental health. Previous research we've done where we interviewed actually mothers with hepatitis B has shown that there's lack of information provided to mothers. Mothers were afraid, for example, of breastfeeding their child, hugging and kissing their children because of fear of transmission, which obviously we know that that's all okay. There's a lot of misconceptions about hepatitis. And so engagement, community education is really, really important.
You're the chair of Hepatitis B Voices Australia. You're obviously passionate about awareness for hepatitis. What have you learned about teaching the community about hepatitis?
I think we still have a long way to go, but what we have learned so far is that we need tailored, culturally appropriate, culturally safe educations that's often led by community is the most effective way because it's not one size fits all. One
Mm.
thing that works for one community or one person is not going to work for everybody. What we've learned is that engaging community early and coming up with initiatives and strategies that resonate with them rather than a whole of, this has worked somewhere else. So that's it. And we're
Mm.
just going to roll that out. But we've done some amazing work in Australia, which I think we should be really, really proud of. We have national strategies, state strategies on hepatitis B and C, which is amazing. They give us the framework and the guidance. Australia has a commitment to eliminate hepatitis by 2030, which is very ambitious. And I don't think we will reach that target with the current projections. For hepatitis B, for example, 30% of people living with chronic hepatitis B are undiagnosed. And only 50%, so half of those that are diagnosed, are engaged in care. And this is really
Wow,
terrifying.
there's some pretty big numbers.
Absolutely. So it's about the cascade of care. So we diagnose people, we engage in, this community engagement, but a lot of it and a lot of the work is how do we engage people throughout that because people need regular monitoring with their GP to monitor and to prevent liver cancer. So it's about not just prevention, but also ongoing monitoring and care.
It's a common recipe, if there is such a thing when it comes to awareness, to have community led, culturally appropriate resources. And it's really a preoccupation of anyone who works in public health. Are we as Australians investing enough in hepatitis?
Yes and no in some instances. I think so for hepatitis C, we've had cure. It doesn't have vaccination, but it has a cure. And this was recent a couple of years ago, which is really exciting. And Australia has been a leader in the hepatitis C response. However, for hepatitis B, like I said, there's no cure, but there
Mm.
is vaccination, and I think there is gaps in there. There hasn't been as much investment and resourcing for hepatitis B across the board, and so it is challenging because you can't do much if there aren't any resourcing or investment behind it. It kind of impacts everything else around research, community, primary care. It impacts people across the board. So absolutely we need more focus, for hepatitis B. And I think the misconception is always because Australia's prevention component of hepatitis B is we're doing well. That is true. But the cascade of care for people who already have hepatitis B, not so much. There's a lot of work that we can do in that area.
You're very knowledgeable about hepatitis and Australia, and it's a great opportunity to ask what's next.
I'm excited that we have national and state commitments to hepatitis elimination. What is next and what I would love to see is, more community-led, community-driven initiatives. Again,
Mm.
that requires resourcing and partnerships with communities to be able to deliver culturally safe interventions. This is to reduce stigma, discrimination, to support people. And I think sometimes when people think about chronic diseases in general, we think about the clinical side of things. But chronic diseases also have a huge impact on people's mental health, people's social circles, their communities. There's a lot of stigma and discrimination. So it's very complex. It's not just, test, diagnose, and treat, and that's it. There needs to be a lot more work and in partnership with community.
How can we do better when it comes to awareness?
Awareness, especially when we're talking about communities who, for example, might not speak English or might be in rural regional Victoria or might be not engaged in I'm thinking about someone who's newly arrived, like their perspective and understanding of hepatitis is going to be completely different to, say, someone who's born and raised in Australia. So I think it's about how do we work and better partner with different communities in a way that makes sense to them. And I absolutely think we still, need more awareness, more engagement. We've seen people, unfortunately, lose relationships, lose their careers, their jobs because of the stigma associated with hepatitis and hepatitis B. So there's a lot of work to be done across the board within community, within health services, within our institutions.
So tell us, where do we find more information about hepatitis?
Please speak to your doctor. That's your first point of contact always. There is also hepatitisbcommunity.org.au, which is an online support group for people living with hepatitis B, and this can be accessed anywhere in the world. There's also the National Hepatitis Info Line, which is hosted by Hepatitis Australia, and it can provide confidential and free hepatitis information and support. You can always contact us at Hepatitis B Voice Australia for more information, or you would like to join our course of amplifying the voices of people living with hepatitis B.
And Hepatitis B Voices Australia, that's hepbvoices.au.
That's right.
Thanks very much for joining us. You've been listening to Matter of Vax. You can hear more podcasts on this subject matter and see the video at www.ifa.org.au and hear more Matter of Vax wherever you listen to your podcast.
Immunisation Foundation of Australia. Supporting immunisation, saving lives.